Assalamu alaikum. Today our topic is pharmacokinetics, and it means how the body acts on the drug. Does it take it as a foreign body, meaning xenobiotics, or does it take it as a friend? So, it involves the study of absorption, distribution, metabolism, and drug excretion. You can remember it by ADME. Okay, ADME, which means A for absorption, D for distribution, M for metabolism, and E for excretion. Okay, so overview. Our aim of giving drugs is the therapy of the person, the therapeutics involving it, meaning we need to fix the person, to cure him or control various diseases. Okay, it says adequate drug doses must be delivered to the target tissues. Okay, so the therapeutic yet non-toxic levels are obtained. We cannot give the drug in excess. We need to know that how much drug should be given to a person so that it doesn't convert into a toxic substance and harms the body. Okay, so too much drug will result into toxic effects. The person can die or can have morbid effects. Okay, and too little will not result into the desired therapeutic effects. We need to see when there is the half-life of the drug. Okay, so fundamental pathways of drug movement and modification in the body. As you can see, drug at the site of administration, then there is absorption after it is taken in the body, then there is drug in the plasma, then it goes in the plasma after the absorption, and then there's the distribution of the drug, and it goes into the tissues, and then there's the metabolism in the liver, and then there is the elimination in the kidneys, and drug can metabolize in urine, feces, or bile. It also goes in the bile. What are the routes of drug administration? Determined primarily by the properties of the drugs. We mean that its properties can be like it can be acidic, weakly acidic, or weakly basic, and it can be absorbed in acidic medium or basic medium. These are meant by the properties of the drug. Some cannot withstand the harsh environment of the gut. So major routes of drug administration are enteral and parenteral. Enteral means through the mouth. Okay, and these are some examples of enteral. In the GIT, which means they are directly made to go in the GIT. Nasogastric tube is directly made to go in the GIT. Then there's the total parenteral nutrition in the vein, intravenous administration. There is the gastrostomy tube direct in the stomach, and then there's the jejunostomy tube in the jejunum, and the parenteral away from the GIT. These are some examples. The intramuscular injection, so subcutaneous injection, or intradermal. This is the subcutaneous, this is the intradermal. Sorry, this is the subcutaneous, or this is the, okay. Then there are the entry routes. Oral, it can be sublingual, underneath the tongue, and the rectum, because rectum is also the part of GIT. The parenteral routes are IV route, IM route, and the subcutaneous route. Okay, so parenteral is advantages and disadvantages. It is fast, 15 to 30 seconds for IV, 3 to 5 minutes for IM, and subcutaneous. 100% bioavailability, meaning it is 100% available for use and it was not wasted. in the GIT. For example, if we give the drug through GIT, only 16% is bioavailable. Suitable for drugs not absorbed by the gut, and those that are too irritant. Yes, anti-cancer, they are too irritant, that's why they are given parenterally. IV can deliver continuous medication, for example morphine for patients in continuous pain, saline drip for people needing fluids. What are the disadvantages? More risk of addiction because there is 100% bioavailability, and Belonophobia, the fear of needles and injections. Yes, that is very, very fearsome. If needles are shared, there's a risk of HIV and other infectious diseases. Dangerous route of administration. If not done properly, potentially fatal air polysis, bubbles can occur. Need for strict asepsis. Parenteral. Used for drugs which are poorly absorbed in the GIT, meaning they cannot withstand the harsh environment of the stomach or of the intestine. The intestine environment is basic and the stomach environment is acidic. The drugs become unstable, and it is also for unconscious patients. Circumstances that require rapid onset of action. We cannot wait for 40 minutes. GIT takes 40 minutes. Provides the most control over the actual dose delivered to the body. So, routes of drug administration. Enteral includes oral from the mouth. It is the most cheapest, non-invasive, most complicated, the most variable, and the most common. The routes, there was a note here, sorry. Most drugs are absorbed in the GIT and encounter the liver before they are distributed into the general circulation. 70% is wasted in the liver, it is metabolized. 16% is reached into the plasma, okay? Then there is the enteral. The B part is sublingual, underneath the tongue. It can be nitroglycerin or some drugs which lower down the BP most of the time. Allows the drug to diffuse into the capillaries and therefore to enter the systemic circulation. Advantages are the drug bypasses the intestine and the liver and thus avoids the first pass metabolism, and it might be in a large amount, not 16%, which comes if the drug goes into the GIT. What are the routes of drug administration? The third route is rectal. It is also from the enteral. This is the rectum. Useful if the drug induces vomiting, if given orally. Then there is the drainage of the rectal region, bypasses the portal circulation. And it is similar to the sublingual route. It prevents the destruction of the drug. Okay, then there is the parenteral routes. IV injection is the most common. Bypasses the liver, the drug which are not absorbed orally. Rapid effect. Can introduce bacterial contamination and can cause hemolysis. Then there is IM. Acylation, specialized depot preparations. Then there is the subcutaneous. The absorption is somewhat slower. Okay. Then there is the inhalation. Others. Examples. For example, there is a rapid delivery of the drugs across the large area of the mucous membranes of the respiratory system and the pulmonary epithelium. The effect is rapid as IV injection for gaseous drugs, for example salbutamol, albuterol. The advantage are faster methods, 7 to 10 seconds for the drug to reach the brain. Disadvantages are the most addictive route of administration, instant gratification. It means instantly, Okay, routes of drug administration. Then there's the intranasal inhaler through the nose. For example, the nasal decongestions, desmopressin, and there is can be cocaine. People take cocaine from the intranasal route. Routes of drug administration. The third one in other is intrathecal or intraventricular, introduced directly into the cerebrospinal fluid. For example, in cancer patients, amphotericin B. Then there is the topical, meaning on the skin, where the local effect of drug is required. Clotrimazole, atropine, it is used for fungal infections. Fungal, pertaining to the fungus. Then there is the transdermal, across the skin. There's patches, for example, nitroglycerin, and LSD, a drug, can also be taken to a transdermal route. It can be put on the tongue as well. It is the transfer of drug from its site of administration to the bloodstream. The absorption. In IV delivery, the absorption is complete. Okay, transport of drug from the GIT. Then there's the passive diffusion in the GIT. The driving force for passive absorption of a drug is the concentration gradient. The drug moves from the region of high concentration to the lower concentration. It does not involve a carrier, it does not involve the ATP. Okay, because it is passive, it doesn't involve ATP. Then there is the active transport involving ATP and involving specific carrier protein, energy dependent, hydrolysis of ATP. The energy is obtained from the hydrolysis of ATP, and it is also capable of moving the drug against the drug gradient, concentration gradient, meaning there is less drug here and more drug here, and it can still move the less drug to the site of more drug by using ATP and the energy. The absorption of drugs, the physical factors influencing absorption: blood flow to the absorption site, total surface area available for absorption, contact time at the absorption surface. Then there is the bioavailability of the drug. It refers to the fraction of an administered drug that reaches the systemic circulation. The drug which was successful in reaching the systemic circulation. And there is different bioavailability for different routes of drug administration. The most bioavailability is 100%, which is obtained from the IV route. The bioavailability of the GIT is 16%, and the drug distribution, the other topic, that it is the process by which a drug reversibly leaves the bloodstream and enters the interstitium, okay, for acting on the tissues, and it is affected by the following factors: the blood flow, the capillary permeability. Okay, if we increase the blood flow, there is increased blood distribution. There is capillary structure and blood-brain barrier in the capillary permeability, and the binding of drugs to proteins. Okay, and if the capillary permeability is more, there is more drug distribution occurs. And if the binding of drugs to proteins, if the drug is bound to a protein, it has more bioavailability. If the drug is in free form, there will be more excretion of the drug. Binding of drugs to the plasma proteins. Bound drugs are pharmacologically inactive and only the free, unbound drug can act on the target sites in the tissues. This is a very important concept and elicit a biological response and be available for the process of elimination. If it is active, it will be eliminated. It is for sure. And if it is bound, it is inactive and it won't be eliminated unless or until it becomes active. Binding capacity of albumin, it is reversible. Okay. Albumin has the strongest affinity for anionic drugs. Okay. Anionic means negative. And hydrophobic drugs. Hydro means water and phobic means they are afraid of the water. They do not go near the water. They are not dissolved in the water. Okay, then there is the drug metabolism. Drugs are often eliminated by biotransformation and excretion into the urine or bile. Liver, the major site for drug metabolism. Okay, what is biotransformation? It is the process of turning the drugs into more lipophilic form so that it can be easily excreted into the urine. Hydrophilic form, not lipophilic, meaning polar form. We will attach OH, COOH or NH2 in order to make it more hydrophilic. There are two phases of drug metabolism so that we can excrete it out of the body. We cannot eliminate lipophilic drugs, meaning lipid loving drugs, because when they are in the kidneys, they go into the kidneys again by apoptosis. Sorry, not apoptosis. Yes, apoptosis. Yes, through apoptosis. No, by cytosis. Phagocytosis. By phagocytosis, they go inside the kidney again. And the agents must be first metabolized in the liver using two general sets of reactions, phase 1 and phase 2. Now we will see what is phase 1. It converts lipophilic molecules into more polar molecules by adding OH, NH2 or COOH, carboxylic acid, amino acid or hydroxylic group. Okay, it may increase, decrease or leave unaltered the drug's pharmacological activity. Often uses the P40 system, the cytochrome P40 CYP. Okay, it is a family of 20 and then there is the phase 2 reactions. There is the different cytochromes CD4 and 2D5, I guess. It is used in the intestines, and there is the different different cytochromes used in different phases. For example, you can see the examples from your book. I will mention Lippincott. There is a detailed mentioning of the cytochromes in Lippincott. Then there is the phase 2, consists of conjugation reactions, and it uses the substrate like glucuronic acid, sulfuric acid, acetic acid or an amino acid. It renders the metabolites inactive and more water soluble. Okay, because there is conjugation. For example, there are drug plus some other substance, and this reaction will be called conjugation. For example, we use glucuronic acid, sulfuric acid, acetic acid or an amino acid. Okay, the highly polar drug conjugates may then be excreted by the kidneys or bile. We can convert morphine from codeine, and it will be more potent but biologically inactive, and it will be excreted through the kidneys. Drug elimination. The most important route is kidney or urine. Other routes may include bile, intestine, lung, and milk. Drugs that have been made water soluble in the liver are often readily excreted in the kidneys. Kidney dysfunction can lead to toxic level of the drugs in the body because the drug cannot be excreted then, because the kidneys are dysfunctioning and the drug is being retained in the body and being reached to the toxic levels. Thank you for listening. Please like, share and subscribe. Goodbye and Allah Hafiz.